Thank you so much, everyone. And I want to apologize for anyone who was in the middle of a sentence and we cut them off and come back to the room. But we appreciate all the participation and all the stories shared in the breakout rooms and all the thoughts and opinions. So thank you so much to everyone. And I think we're going to move to the next and last part of our symposia before we wrap up is talking about challenges, methodological challenges, conducting research in the MENA, immigrants and refugee groups. Alexandra, I think we have a couple of slides for that, but it's more of a leading discussion point. What we would like to have in this forum, open forum, is to people share their thoughts and their experiences, and hopefully we can share and participate in putting out things that we need to do and maybe have some actions that we can work on in the near future. So can I have the slides, please? So I will ask Madiha to join me in leading this discussion, and I listed here some of the things that we definitely already heard about throughout the presentations, but you know, if you have any additional thoughts or points, please feel free to share. Mainly, we talked about the invisibility of data regarding the MENA and immigrant and refugee groups, how sometimes it's hard to find data about these groups because they're lumped into different categories, and sometimes these categories are not representative. As I shared in my breakout room, when I started my work within the Arab American adolescents, I have to look at the literature under Muslims, under immigrants, under refugees, under white, national data. I have to look and see if they actually include them under others. So it is hard to find data, especially because they are not considered a separate minority group and also misclassified sometimes. A huge thing that I learned about doing multiple projects within the Arab American community is the medical mistrust. And especially during COVID. So I was doing a research study that requires collecting blood samples, and I can't tell you how many people turned our invitation to participate in the study just because of that and uncertainty how we're going to use their samples, and feeling that we're doing something bad or it's related to COVID somehow, although it's not, although we explained how we're going to use it and why, and how legally we are obligated not to use it for other forms. I'm just sharing my experience with at least the first 2 points, but really I want to hear from others regarding any of these points, any of the things that you see in your practice, you know, and you can talk about it.
I just want to actually add something to that about mistrust. You know, we've been talking a lot about all the strides that have been made in you know, in inclusion of MENA category in databases and on the state level. But because of the mistrust, you know, one thing that's really important for us to focus on moving forward is getting the community on board. A couple of days ago, I was telling my group, like, we had a person who was signing up for Medicaid, and they were Arab American. And when she asked them, what is your ethnicity? He said, no, don't put me as Arab American, put me as white, because I want to get my Medicaid application to be approved faster. So, you know, systemic racism, discrimination, all these factors, negative political rhetoric have created so much mistrust in the community that we really need to build that back in order for data, you know, categorization to be successful in this country.
Thank you so much. I see that others are sharing in the chat, and in terms of cultural differences. And I just want to say that the barrier is not only the cultural difference, but the amount of information new people coming to the United States need to process in a very short time. So it's really cultural shock, like learn about the health system, learn about legal stuff, how to speak the language, where to settle, what you're allowed or not allowed to do based on your status in the country, for how long. So the amount of information is a lot, and depending on the family and how many members and their education and all that, and how they can process all these information. And the cultural difference sometimes can be in the small things, not only how cultural differences regarding to food or some of the common cultural factors, but also can be how they think, what they think about illness and health, and how that will translate into practice. So it's a lot of factors, um, but it's really important, and it's really important to be considered if we want to make our group or the group we are serving needs visible.
So,
But I'm really interested to hear if anyone have experience or story to share regarding that.
so this is Linda Jaber. I relate to many of the things that Maha and Madiha are talking about. I'll give an example. One of the major barriers we found doing research in the Arab American community was a general fear and suspicion, especially of large institutions, even universities and government agency. For example, one of the studies, before we start the study, we field tested the consent form as well as the study questionnaire. And remember, like in the consent form, there is a standard disclaimer that the data obtained will be disclosed to the FDA and other governmental agency. Plus the questionnaires were asking information, for example, like religious conviction or economic status. The community members pointed those as like part of like racial profiling or like confidentiality issues. So I remember at that time we went back and revised the consent form to minimize, like to enforce that whatever data is being collected is confidential. But we also did many other things. For example, working through Access gave us a little bit of more like trust among community members. Plus, we relied on community leaders. Like I remember going to public schools and talking about the study to parents that attend these meetings. I went to mosques in Dearborn and spoke about the study. We put like little news briefs in the newspaper that's more like Sada al-Watan, that's circulated in the Arab community. Like we did several steps in order to comfort people that the information is not being used. So mistrust is a huge issue. Income is a big issue. Like I ended up dropping most of the income data because I wasn't sure how accurate this was. Having a member that they trust, like I am an Arab, and so many times I had to visit the house myself so they can get a little bit more relief. There are a lot of other barriers that if you want, I can talk about them too. One of the things like I've discovered is that Arab in general do not like preventative or like doing testing because they're so afraid of uncovering a medical problem. Like there are so many myths and misconceptions about things. And so it takes a lot of work, effort. It takes a lot of, you need to collaborate with organizations in the community, key leaders. You need to do programs to correct misconceptions. Like there's so many barriers. and this is not specific to Arab Americans. Like I've looked at a lot of studies done in Arab Americans, in African Americans or Hispanics, and they sort of have very similar problems and very similar barriers. And the literature is so rich with information and strategies to overcome these barriers.
Yeah, I want to jump in here as well, because just a little bit, just some thoughts, because I do research in medical mistrust, specifically like we call group-based or race-based medical mistrust, or mistrust that really comes from legacies of bias and discrimination and racism. And although I'm doing a lot of work with other people about shifting that paradigm, that, because for many communities that mistrust is valid, right? It's reinforced, it's real, that profiling is real. So we've been thinking more and shifting the paradigm about institutional trustworthiness. And I think it's worth, there are strategies that people are using, like, and it's coming up here, identity safety cues. Like, how are you very intentionally communicating, and how, as a hospital or as an organization, that the risk of discrimination is going to be limited, that stigmatization is going to be limited in that setting. And I think there's a lot of work that we can maybe perhaps doing around that, in addition to just also having diverse staff and faculty and folks who reflect the community as well. So that's just a thought there, because again, I don't want to just mistrust is, that mistrust is protective. That mistrust is valid, it's supported, and it's not necessarily a community problem. It's an institutional problem. It's a provider problem. So that's just a small point I wanted to make. But also, I just always, as part of that, working with community organizations, I think is always key, and can help to overcome some of that.
If I may add here, I don't want to dominate this, but I had so much work within the community in terms of research. But one of the things which I think also have been shown in the African American is that when we do research, like these people come from academia, they do their research, they participants feel like they're more like guinea pigs. You take your data and you leave. One of the things we tried to do was to go back to the community and tell them what did we discover or uncover, or what is our future plan. Like, you sort of involve them, like this is our project, like including the participant, not because I am a professor and I need data and publications and things like this. So they feel like they have some investment in the projects you're working on. And that alleviates some of their mistrust.
I just wanted to jump in. Hi, my name is Amal. I work with Wayne County Healthy Communities, which is a nonprofit organization that Dr. Hamami actually founded. Linda, I completely agree with a lot of the points that you made. Many of our patients, so we serve like a high immigrant population, and many of the patients that we serve just have a general mistrust with the healthcare institution in general. A lot of our patients have told us, even when they go deliver in the local hospitals, they're discriminated against, and that has actually impacted birth weights and led to low birth weights. So, I think in addition to diverse staff, it's also working with, hospital institutions and referral specialists. So right now our biggest goal is to identify different local specialists that have diverse staff, and we actually have conversations with them to ensure that when we refer patients to these several different places, that they are being taken care of, they're not being discriminated against, that they will see them even if they're Medicaid or uninsured. And we've also been working with identifying, community champions to help. So even just students who are well known in the community or religious figures, that has been a huge help in relieving that mistrust.
So I want to say that I shared a study that I did with my colleague, Dr. Khalil, and also PhD graduate, Shahrazad. We wrote a paper based on the projects we did among the Arab American community. We wrote a paper about challenges and some of the strategies we used to overcome those challenges, conducting research, especially on sensitive topic among the Arab American community. So I can provide this, later for everyone attending. Any other thoughts or ideas these points bring to your mind, please feel free to share with us.
Also, just here, I just want to kind of put in a little plug. What we're going to be doing after tonight is pulling together all these notes and summarizing them. But there's going to be an ongoing work group to kind of build upon the recommendations and the priorities and the issues discussed this evening. We've been doing this again across different groups as a Center for Health Equity at Wayne State, so that we could have a community informed or community partnered agenda. That's the whole point why we wanted to bring a lot of people to the table. And again, so I want to put Carrie's reminding me to let everybody know that the dates for this particular network, research and partnership network, has been set. Is going to be the second Tuesday of the month from 12 to 1 p.m. So please, keep that in mind. We will remind everybody who's registered today and yesterday about that. If you want to kind of participate and kind of continue to really build a program or something systematic around at least one of the topics, or one of the maybe the most one of the more salient topics that have emerged out of the conversations, please join that group.
These are great. And I just want to mention that all these challenges right here, they kind of doubled after COVID. So overall, we heard, like right now, vaccination rate decreased 20% in the national level. So even vaccines other than COVID, people are not taking their vaccine or not willing to take a vaccine, and including the flu vaccine, which we made a progress before, convincing people to do that to protect their health. So overall, COVID made things worse and increased the medical mistrust and, suspicion about people's health. So definitely the data will look different after COVID. Okay, so I think like everyone is exhausted and ready for dinner. So I wanna say that we appreciate everyone feedback and points. Please feel free to email us. You can find our contact in the program, the Symposia program. Please do not hesitate to share thoughts and ideas beyond the symposia with the committee. We appreciate your feedback. And as Haley shared, that we actually plan to take this into action and build on it. And I'm gonna borrow your quote, Haley, this is the beginning, not the end. So this is exciting and I'm happy to be part of it. And please reach out if you have anything to add. So anything else I need to say before we say thanks to everyone and have a good night?
Alex, if you could plug the evaluation in the chat. Sorry.
Yep, I just put it in the chat.
Please complete the evaluation. And we'll send it, we'll email it to you, it's in the chat, but please complete the evaluation so we can help us move these kind of meetings forward and do this again.
Thanks for the reminder, Carrie. Yeah, we need those evaluation to keep working and build on what we shared in the all symposia. So thanks everyone, and have a great night.
Thank you everybody for over the past 3 months for all this this time together. We appreciate that your participation and involvement. Thank you.